Hello. So this week we were asked to discuss a significant event that has happened to us in our nursing career, and I think that this is a little bit easier for me. It's somewhat easy for me to discuss. I've been with the current healthcare organization that I'm with for 2 years. I just celebrated my 2 year anniversary. I was with the previous healthcare organization that I was with for 10 years. And the healthcare organization that I was with is, prior to this, was a large healthcare organization in the state of Illinois. Both of them are large healthcare organizations. The one that I'm with now is larger, but the one that I was with prior was a private Catholic healthcare institution. And so there were some things that were just more encouraged in that environment. Spirituality was encouraged. Touch was allowed. I don't want to say necessarily encouraged, but if it was appropriate in the context of the situation, then it wasn't discouraged. And I'm not sure that I necessarily feel that much freedom in the environment that I'm in now. And a lot of times just working inpatient in a psychiatric ward, I feel like especially when there are patients that become very angry and get out of control, that a lot of times when we're reassuring them, what they need is just that trust with the people that are around them, and they need to be able to trust. And some of the events that have stood out to me in my nursing career are just those times when those patients have just really lost their cool and are spewing out F this and F that and getting other patients worked up on the floor. And those memories stand out to me because I felt handicapped in that I'm not allowed. I can calm them with my voice. I can calm them with my actions. I can reassure them with my words. But taking that next step and just physically just putting my hand on them to touch them is not necessarily allowed or encouraged. And maybe that's a good thing. I don't know. Maybe it would be uncomfortable for some patients. But I feel like human touch is so much of an integral part of just who we are and just care as patients. And so those are definitely the times that stand out to me the most as just a nurse, is when patients have been just really upset on the psych ward and have just been, kind of out of control, and not just a situation where we've had to use sedatives or restraints or anything like that to get them to calm down, but just where they've been very upset after phone calls or something like that, and we've had to use words and things to get them to calm down. But just thoughts in my mind where I wish that I could go on and take that extra step and just touch them. And I think as a provider, I might feel more comfortable in just reaching my hand across and just maybe touching their arm or something like that, and just saying, hey, it's okay. It's okay. And I guess I would have to kind of explore that a little bit. But those are areas that I feel like kind of stand out to me as times that have stood out to me in my nursing career, where I felt like I'm kind of chained or handcuffed and not being able to take the human experience to that level. Thank you.